Hello there, welcome to the whole month of November, when we are focusing a lot more to men's health than the previous month where we're focusing on breast care and also breast health. For the first week of this installation, we're going to talk about testicular cancer. In fact, the whole month we're going to talk about testicular cancer. One of the problems about testicular cancers is that there are certain risk factors that may predispose somebody to get testicular cancer. And one of them is called microlithiasis. Micro obviously means very small. It's in fact 1 to 3 millimeter. Lithiasis actually just means that it is a little bit of calcification or stones inside the testicle. Why is that the case? In fact, nobody knows. So testicular microlithiasis is actually common. It's as common as 1 to 9% of the general population. If it's so common, why is it so worrying? In fact, what is worrying is that it is related to certain men having predisposed risk of getting testicular cancer. So, what is the link? In fact, nobody knows. What we know is that perhaps the germ cell is actually undergoing changes. It's called dysgenesis, or perhaps it's because of atrophy, because of age degenerations, or because of regular inflammations, or even something like a genetic causes such as Down syndrome are more predisposed to that, and also people who has problems with Klinefelter, which is a genetic conditions. Under these circumstances, the risk of getting testicular cancer is about 20 times higher than general population. So therefore, if somebody has got discomfort in their testicle, an ultrasound show that the testicle itself has got these microlithiasis, then we would like to monitor the individual throughout a period of a time so that we know that they don't develop testicular cancer. So microlithiasis itself also is related to men having infertility. So that itself, we don't really know whether it's a cause or the effect. So sometimes infertility itself will cause degeneration of the germ cells and cause microlithiasis, and microlithiasis itself may also induce all these problems of infertility. But what we know is that men who are infertile are more likely to have testicular cancer as well. For the following week, we're going to discuss how is testicular cancer presented, and then exactly what can we do in order to identify whether this is cancer or not, and what treatment is given to men who are presented with testicular cancer. So stay tuned for next week's Putting Dr. G on the Spot.